All right, good afternoon, everybody. Welcome and thank you for joining. We're very glad to share this overview of a new data sharing agreement, the IZ Gateway Multi-Jurisdictional Vaccine Provider Jurisdiction Data Exchange Agreement, or PJA. The purpose of this session is to review information needed by parties to support the execution of an agreement required to exchange data with the Department of Veteran Affairs and other multi-jurisdictional providers. To do that, we'll go through the following agenda, starting with an overview of the IZ Gateway and its use cases, then moving to security considerations and jurisdiction controls, and then going to talk about the IZ Gateway legal framework and a deep dive into the PJA. We will end with time for questions and answers. If you have questions along the way, please put them into the Q&A box, or you can unmute yourself. Our speakers today are members of the IZ Gateway team, focusing on programmatic work. And so the member of the IZ Gateway team that you'll be hearing from today is Lindsey Lowinski, and Carrie Waggoner from NPHL provides legal support and guidance to the IZ Gateway team. You may take time to review the speaker bios when the slides are posted to NPHL's website. And with that, I will hand it off to Lindsey Lowinski.
Thanks, Michelle. All right, we'll get right into it. So the IZ Gateway overview. Next slide. So the IZ Gateway is a cloud-based message routing service for immunization data exchange. It offers a consolidated integration hub for data exchange with standard onboarding and testing procedures. And of note for this group is the policy framework the IZ Gateway brings to bear in order to enable immunization data exchange through the IZ Gateway with a variety of partners, including federal agencies and the VA and others. Next slide. So as noted, the IZ Gateway is a message router enabling complete patient immunization histories for IIS providers and consumers. It's really important to note that the IZ Gateway does not store data, act as a message repository, or send data to CDC repositories. Next slide. So we'll get into the use cases here. There are 3 in total, but the first is data exchange with vaccine providers, and that is a use case that's relevant for today's discussion. And then the other 2 are data exchange with IIS, and then data exchange with patient applications or patient portals for consumer access. Next. So this data flow diagram depicts data exchange among the parties, starting on the left-hand side with multi-jurisdictional vaccine providers, then to the center there to the gateway, and then to the IIS as the final destination. The IZ Gateway software is cloud hosted by the Association for Public Health Laboratories, or APHL, on behalf of CDC. So the arrows, as you can see, are double-sided because with each VXU or vaccine reporting message comes an acknowledgement message also. And then with every QBP or query for vaccine history comes the vaccine history or a related response. Also note that on the right-hand side of this diagram, it depicts existing data exchange relationships with the IIS, and the IZ Gateway does not aim to replace those existing functional relationships. Next slide, please. So use case 1, data exchange with vaccine providers. I want to highlight the policy requirements for this use case. First is the APHL DUA, which most jurisdictions have signed. The next is the multi-jurisdictional vaccine provider to IIS data exchange agreement, or the PJA, which we're here to discuss today in more depth. And that was distributed on January 14th. This use case allows for vaccine administration information and vaccine history queries to be sent to IIS from vaccine providers. Next slide. So I want to briefly touch on the policy requirements for the two other use cases in order to provide a frame of reference for the legal framework overall. So IIS, the IIS exchange or exchange with peers, they must sign the interjurisdictional MOU and complete the shared task order in that APHL DUA previously mentioned. And then next slide. And then to participate in consumer access, that APHL DUA must be signed as well, along with the access task order to that DUA. Next slide. So IIS controls and security. So one of the key things here is we drive home that the IIS have control of how they interact with data exchange partners through the gateway. They choose the use case that they'll participate in and with which partners they choose. They must also set up or enroll data exchange partners in order to receive the data. So there's a technical piece to that as well. And the big takeaway is really that your jurisdiction's IIS will never receive any data without prior consent and work to test the exchange so it meets your data quality standards. Next slide. So here a little bit more on security. So similarly, the data is encrypted while in transit, and neither APHL, which hosts the IZ gateway, nor the IZ gateway itself collects or maintains PII. It conforms with all of the policy framework security standards included in the agreements signed by data exchange partners, like the DUA, MOU, and the PJA. Next slide. So with that, the overview has been complete. So I will hand it off to Carrie to discuss the legal framework and get into some more details about the PJA. Thank you.
Thank you, Lindsey. Good afternoon, everyone. I'm Carrie Waggoner with the Network for Public Health Law. And as Michelle said, we provide legal support to the IZ Gateway project. So what that means really is we are not acting as anybody's attorney, but we work to help develop and then facilitate completion of the legal agreements needed to exchange immunization data through the IZ Gateway. So the kind of first order of business, I want to walk you through the IZ Gateway legal trust framework, the various legal agreements that are required to participate in the different use cases that Lindsey just went over. And I've got a number of animations on this slide, Michelle, so I'll just say next when I want you to advance. So next.
Got it.
Thank you. So in the middle of our slide, you have the IZ Gateway, that green kind of gear, and it's hosted by the Association of Public Health Laboratories, or APHL, again under a cooperative agreement with CDC. Next slide, or advance. So on either side of the slide are the parties. So on the left-hand side, you have the provider organizations, which would be federal agencies like Veterans Affairs, and other federal agencies like Department of Defense or Bureau of Prisons that will onboard to the project later on, or you have your private multi-jurisdictional providers on that left-hand side of the screen. And then on the right-hand side of the screen, those blue globes represent the various immunization programs. Next slide. Or advance. And so just filled in are all the various legal agreements required to participate in the various use cases. In particular, the use case 1 that we're focusing on today, data exchange with vaccine partners, and then use case 2, data exchange between immunization programs. So I'll start, starting again with that gear in the middle. I'll talk about the various agreements that are required with APHL to exchange data through the IZ Gateway. So for immunization programs, or as we tend to call them, jurisdictions, you have on the bottom right-hand side that APHL data use agreement. And as Lindsey mentioned, that is the baseline agreement that is required. So baseline, we mean it's required for all of the use cases in order for an immunization program to share data through the IZ gateway or receive data through the IZ gateway. On the sort of bottom left-hand side, and then right up above it to not quite the top of the left-hand side, thank you for the cursor, are the agreements that the provider organizations enter into with APHL. So for the private provider organizations, they'll enter into a business associate agreement with APHL because those providers will be subject to HIPAA, and by routing PHI in the provider's cases, say to immunization programs, they'll need that business associate agreement in place. And then with the federal agencies, because the IZ Gateway is sponsored by CDC, it was determined that the federal agencies will most likely have a memorandum of agreement with CDC to participate and share and receive data through the IZ Gateway. So those are the agreements that the parties need with APHL or with the IZ Gateway to exchange data. Now shifting over to, now I'm going to shift to the agreements that are needed between the various parties to exchange data. So on the right-hand side, we've got the APHL DUA, and then we've got our globes representing immunization programs. In order to exchange data between immunization programs, so that use case too, you also have to sign the interjurisdictional MOU. And actually most jurisdictions, I think 50 plus, have signed that agreement. So, you know, by and large, most jurisdictions have already entered into that agreement. And so last but not least, I'm moving up to the very top of our screen, kind of in the middle there, where we have the PJA, and that's the document we're here to talk about today. That's the provider jurisdiction agreement that will take the place of provider organizations needing to sign individualized agreements with each and every jurisdiction that they want to share data with, and there are up to 64. So that in a nutshell is, and hopefully visually is, are all the legal agreements required to participate in use case 1 and 2 and exchange data through the IZ Gateway. The next slide, please. Just give a really quick, and next slide, hit on a couple of points with that data use agreement. Again, that's required to participate in all use cases. You know, we certainly get a lot of questions about security of the information, understandably, and I just want to pull everybody back to, again, most jurisdictions have entered into this data use agreement and the security terms within that agreement. So the IZ Gateway itself complies with FSMA, HIPAA, and FedRAMP. And also the task order, as Lindsey mentioned, that's the appendix to the data use agreement. And that is where jurisdictions are able to select the various use cases you wish to participate in. So jurisdictions are really in the driver's seat there in terms of having control over which use cases you participate in. Next slide, please. So again, our IZ Gateway legal trust framework, and just want to draw you that going forward, we're going to start that deep dive into the provider jurisdiction agreement, or PJA, as you'll hear us call it. Slide. So the PJA itself was developed, you know, as we kind of got ready for this use case provider, or data exchange with vaccine providers. We really start thinking about if jurisdictions need to, if providers need to enter into up to 64 different agreements, just from an efficiency standpoint and a compliance standpoint, that's very difficult. So our task was really to try to come up with a multi-party agreement that hopefully most parties can sign on to and use to exchange data through the IZ Gateway with one another. We modeled it after the interjurisdictional MOU. As I mentioned, many jurisdictions have already signed that. And so given that that structure is something that worked in a multi-party way between immunization programs, we looked at that as a model. We also reviewed 15 different jurisdictions IIS-related agreements. And this, again, is intended as a multi-party agreement to streamline the number of agreements that everyone has to execute. This fall, we solicited IIS review and feedback of the draft agreement and took that into account. And we're happy to report that Veterans Health Administration is actually utilizing the PJA to exchange data with jurisdictions. Next slide. So now the legal stuff. I'll walk you through the key terms. I won't go through every term in the agreement. But first and foremost, the parties, so multi-jurisdictional vaccine providers, and you'll see the sections of the agreement in gray where you can find either the key term or like under parties, that's where section 10 is where you'll find definitions. So the multi-jurisdictional vaccine providers include both federal agencies and then private multi-jurisdictional providers that may onboard to the IZ Gateway. Jurisdictions are the immunization programs. Again, the purpose is to facilitate the exchange of data, immunization data through the IZ Gateway. Next slide. So importantly, I want to point out that the PJA does not prevent other communications or agreements to exchange data outside of the IZ Gateway. It also does not prevent an immunization program from granting direct access to its IIS or from any of the parties from exercising emergency authority. So one of the things as we developed this agreement that is really complicated, and we spent a lot of time thinking through, was how to deal with the varying state and federal laws that will apply to the various parties who may sign on to this agreement. And so we looked at other models, health information exchange agreements, the DERSA, for example, that and how they've approached it. And so that's how we came to using the concept of applicable law. So each party who signs on to the PJA must comply with applicable law. And what that means is that they must comply with all the state and federal statutes that apply to them. And I want to make a special note here that as to the federal entities, they are subject to applicable federal law only. So really what that means in practice is if for a jurisdiction, you'll look at what federal law and state law applies to you and looking at the terms of the agreement, then how do you apply from there. Next slide. So the PJA supports two types of data exchange. So it supports immunization reporting, or that VXU messaging that Lindsey mentioned earlier, where a provider organization reports an immunization through the IZ Gateway to an IIS. And then the second type is immunization query, or the QBP, and that's where a provider may query one or more jurisdictions through the IZ Gateway, and then one or more jurisdictions, again, depending on applicable law and who is functionally exchanging data with one another. One or more jurisdictions may provide that immunization information to a querying provider, so that provider has a consolidated and accurate immunization history. And importantly, I want to point out each party determines the information it provides to another party. So again, IIS are in the driver's seat in terms of what information you push out and to whom. Next slide. And so what do we mean by immunization information? Again, this is the definition here in section 10. Really, it's information that is created by a provider or is created or received by a jurisdiction, so by that immunization information system, and relates to immunization status, be the provision of a vaccine to the individual or medical and clinical information related to immunization. And so the next two, section 14 and 15, are really important, and these were modeled off of the interjurisdictional MOU in particular. Regarding incorporation of data, so a party receiving immunization data through the IZ Gateway, whether it's a jurisdiction receiving a report of an immunization or a jurisdiction responding to a provider, with the vaccine history on a particular individual. So that party that receives it can incorporate the data into their own system, so into the IIS or then into the provider's clinical record. And by doing so, that party affirms that the data is subject to their control, use, and disclosure, and that they are responsible for protecting that data. Slide. So privacy and security terms are required under this agreement. First, by signing, you implement confidentiality policies that protect the privacy of the information received through this agreement. You implement appropriate administrative, physical, and technical safeguards, and make all reasonable efforts regarding information security. HIPAA is the floor in this agreement in terms of most providers will be subject to HIPAA. And again, just to note that federal agency providers must comply with applicable law, or in their case, the Federal Privacy Act, and then there may be federal confidentiality statutes applicable to the data that they hold within their agency. So another important point within this section is breach notification language. So if a receiving party, meaning a party that receives immunization information through this agreement, discovers that there was a breach, they must make reasonable efforts to identify the source of the data, so who they received that data from, and to notify the sending party and administrator. And this is an area where we received some feedback, and we had a lot of discussion as a project team about whether or not to include additional breach-related obligations. And because of, I was talking earlier about that section 14 and 15, the incorporation of data into either the clinical record or the IIS, and sort of taking responsibility for that, is why we didn't go further. And you'll note that that's consistent with kind of the model with the Memorandum of Understanding, that interjurisdictional MOU. Slide. So governing law is just say in the event of a dispute, the applicable federal and state conflicts of law will apply. We'll have to again look at what is the applicable law, and the parties would have to determine in the event of a dispute what law applies. And then some sort of more generic terms. There are terms about withdrawal and termination. So how do you exit the agreement if you need to? Terms stating that there's no monetary exchange between the parties. No warranties are given. Everyone agrees to use their best efforts to exchange data under the agreement. Limitation of liability. Everyone's responsible for their own liability. There's no indemnification as a part of this agreement. And there's no fixed term to this agreement. It will remain in place until a party withdraws or terminates. Next slide, please. So again, similar to the MOU, which has an administrator for that agreement, and it is the it's ARA, the American Immunization Registry Association. And here we have, because of the structure and having a multi-party agreement where you will not have the traditional two parties signing on the same piece of paper, so to speak, we thought it important to have an administrator with that same sort of role for the PJA. And so in this case, the administrator is the CDC. You'll find the contact information for the CDC administration contacts within the PJA itself. That's section 26. And then some of the administrator's key responsibilities that I wanted to bring to everyone's attention today is to maintain signed copies of the agreement and contact information for the purposes of providing notices. So if a jurisdiction, for example, if you need to make a change and update your contact person, you would contact the CDC administrator for that. The administrator has responsibilities about both receiving and providing other parties with particular notices under the agreement. They also need to make accessible a list of all parties who have signed on to the PJA and facilitate addressing questions or concerns. And regarding that list, that's something I can't direct you exactly to where that will be just yet. That is in development, but it's something that will be shared soon. The next slide. And before we go to Q&A, I want to just mention one point that I forgot to mention earlier. In the package that was sent out earlier this month with the PJA and some other agreements, there's what's called a crosswalk document in there. And because we've been referencing the interjurisdictional MOU and some similarities between the PJA and that agreement, we created what we're calling a crosswalk document that looks at the key terms of both the MOU and the PJA and contrasts some of the differences between those agreements. And so we're hopeful that that may help facilitate jurisdictions review. So I just want to draw your attention that may be a useful resource as you review and look at the agreement.
Thank
you.
You.
With that, I'm closing and we can.
Yeah, let's go ahead to Q&A. I don't see any questions yet in either the chat or Q&A section of the webinar. So let's just wait a moment. Please either put your questions in the Q&A box or feel free to unmute yourself and ask your question. Or was the presentation so clear and compelling that everybody's getting ready to sign on the dotted line right after we hang up? Oh, here we go.
Sure. So I'm just getting a note. Two, I guess, further things that, this is Carrie again speaking, that I can share. In terms of we anticipate a question might be, is there a deadline to execute this agreement? No, there isn't, but just keep in mind, timeliness may impact your timeline to actually exchange once we get folks in the queue, and particularly exchange with Veterans Health Affairs. And we anticipate that we may get some questions about how state law works with this agreement. And if you have any concerns about that, we're happy to take questions here today, but understanding that folks may need to take this back and review it with materials, we are happy to set up individualized meetings to discuss and talk through any questions or concerns that you might have.
Thank you. We have one open question. In the data exchange, this is from Caroline Meckel. In the data exchange agreements, what were instructions, if any, to programmers about use cases, specifically integrity requirements? Carrie, are you able to start, and maybe I can add if possible?
Sure. So the data exchange agreements, the legal agreements, don't necessarily give any explicit instructions to programmers. So that's not necessarily captured there. I think it might be more of the technical agreements. So Michelle, with that, I'll turn it over to you.
Yeah, so in terms of complying with instructions for programmers, we have several documents for different use cases that highlight what those requirements are. So for the IIS to IIS use case, we have a functional requirements analysis document. And then for the multi-jurisdictional vaccine provider data exchange use case, we don't have any documents quite like that with requirements, because it's very similar to how IIS generally exchange data with large health systems currently. Does that answer your question, Caroline? Yes, thank you. Okay, great. Any other questions? Donna asks, are those documents available somewhere for programmers to review? And the answer is yes. Many of those documents are available on the ISD awardee SharePoint. And if the people who need those documents don't have direct access to that CDC hosted ISD awardee SharePoint site, you can contact IZ Gateway at cdc.gov at any time with your request, and we'll be happy to send you the documentation that you require. Do we have any other questions? All right, let's conclude. If you have any questions between now and the time that the webinar ends, feel free to put it in the chat or say it out loud. So we do have some next steps. First is to review and garner signature on the PJA. It was sent to IIS managers and immunization program managers on January 14th, 2022. So almost 2 weeks ago. If you have not seen that agreement and you would like to receive a copy, please let us know, and we would be happy to send it to you. Next, you can ask specific questions or request individual discussions by contacting IZ Gateway at cdc.gov. And when we receive that request, we'll be happy to work and schedule a time to speak with you. To improve future PJA webinar content, please complete the short 6-question survey that will pop up once the webinar ends. And finally, you can attend an upcoming webinar or share registration with your colleagues as needed. Here are the dates and times of all of the upcoming webinars. We got one question in from Marie Claire Brown. She asks, are there any particular nuances that we should be aware of in the IZ Gateway agreement between local and state public health departments and federal partners like VA hospitals? Carrie, what do you think? I'll let you answer.
Thank you. So in the case of between federal partners, I think you would need to have that, you need to look at the PJA. So I would draw you to really thinking through the applicable law and how that would apply with your jurisdiction. And then your jurisdiction would have that data use agreement with APHL. And in the case of, say, Veterans Affairs, they have their kind of companion instead of the DUA with APHL. It's the memorandum of agreement with CDC because, again, CDC is sponsoring the IZ Gateway. Other than when I went over, I don't think there are particular nuances. I think as you review it, if you have particular questions or kind of circumstances that maybe you want to think through or talk through a bit more, we'd be happy to follow up on those.
Thank you. Okay. Stephen Murphy asks, going back to the IZ Gateway framework slide, can you speak a little more about the BAA that is shown between the providers and the IZ Gateway here? This is not a typical context for a BAA, and how does a BAA fit in here?
Sure, we can speak to that.
Give me a second to navigate to that slide.
So the providers that will be entering into the business associate agreement with APHL, so that won't typically be your federal providers or federal agencies. It would be like the private multi-jurisdictional providers. So say long-term care facilities, skilled nursing facilities. And so they would be considered providers, meet the definition of a provider under HIPAA. And so since even if they're reporting an immunization, when the provider holds that data, it typically will be protected health information. And so since the information is being sent through the IV gateway, APHL then would be acting on that provider's behalf. And so that's the rationale for having a business associate agreement in that case, as opposed to the data use agreement, say, that jurisdictions enter into with APHL. And also recognizing not every, I think most health departments are either hybrid HIPAA entities, so that their public health functions, particularly like immunization programs, are not typically covered by HIPAA. But in those cases, if a business associate agreement was needed, we could address that as well.
Thank you, Stephen, for that question. We also got the question, will these slides be available? And I do believe that they will be posted to the NPHL website, along with a recording of one or more of these webinars. I'll just flip back to our next step slide. Any questions about these next steps or how to get in touch with us? Or any other questions about the content that we shared today? Okay, well, I think with that, we can conclude today's webinar. Thank you so much for your participation and attendance. And please, again, reach out with any questions and we'll be happy to work with you. Thank you.